Dear Chairman and dear colleagues, I would like to present about one-year clinical follow-up of one-step excavation technique. The purpose of this clinical follow-up was to evaluate the one-step excavation to soft dentin in the treatment of permanent teeth with deep dentin caries lesion. 20 permanent teeth with caries lesion penetrating to 75% or more of dentin were enrolled to this study. Determined inclusion criteria were that individuals age 18–60 years, existence of vitality with positive response to electrical pulp test and cold test, no history of spontaneous pain on the teeth, no sign of pain on percussion and palpation sensitivity. One-step excavation procedure was applied to the teeth. Peripheral dentin including enamel dentin junction was prepared with using slow rotating tool until reached to hard and firm dentin. Then selective removal to soft dentin was carried out on the pulpal side of cavities. The soft dentin on pulpal wall excavation was performed by hand instrument excavator with just finger pressure, without force. After preparation and excavation of the cavities, pure calcium hydroxide paste was placed on the pulpal wall. Then this pulp capping material and narrow dentin layer around was covered with zinc oxide eugenol cement. Capsulated conventional glass ionomer cement was used for temporary restoration. Clinical and radiographic evaluation were performed at 6 months according to clinical signs and symptoms: vitality, pain or discomfort, sensitive to percussion or bite test, and radiographic sign to periapical index of duck Ostrovich. At the same session, temporary glass ionomer restoration were prepared as the base for final restoration. Afterwards, all cavities were permanently restored with resin composite. As a result, 6 participants were female and 12 of them were male. Age average of participant was 30. 2 participants left the clinical follow-up. A total of 18 teeth could be evaluated at the end of year. These teeth were still vital without any clinical and radiographical complications. There was no pulp exposure during treatment procedure. 1 year later, pulpal success of the teeth excavated with one-step excavation technique was determined 100%. Within the limitation of this clinical study, it was concluded that one-step excavation to soft dentin in permanent teeth with deep dentin lesion is a preservative technique with low invasiveness in terms of pulpal recovery. Thank you very much for your kind attention.